Hello, everyone. My name is Ohad Arazi, and I have the pleasure of serving as the Chief Executive Officer of Zebra Medical Vision. Our company is looking to empower healthcare providers to manage the exploding workload and the ever-increasing complexity of medical imaging without compromising quality of care through the use of AI and machine learning. Today, I'm here to talk to you about the use of imaging AI in population health management. So let's dive right in. Based on US data, we know that 90% of healthcare spend goes towards managing patients with chronic conditions. And yet, much of the focus of medical imaging has been on acute conditions, given the fact that radiologists are pressed for time and are often forced to focus only on what matters most. Acute care is also where the imaging AI domain got started, with solutions to prioritize cases with critical findings and create a safety net for radiologists. We've seen this for head CT and a variety of conditions in X-ray. Now that definitely has value, but there's so much more in the data above and beyond the critical finding itself. AI can mine pre-existing data to identify patients who would benefit from interventions that would positively contribute to their health. These tools can help reduce the risk of disease, decrease hospitalizations, and improve outcomes through early detection, ultimately saving the health system significant costs by identifying diseases that are commonly overlooked or that would benefit from earlier intervention. Now, if we look at data sets from chest CTs performed to diagnose acute conditions, we could subsequently analyze these same cases in parallel by an algorithm to identify a wide variety of chronic conditions, such as vertebral compression fractures, coronary calcium scoring, COPD, lung nodules, and more. Let me give you an example. If I get off a long international flight and experience chest pain, I would go to the ER and the emergency room would send me to do a chest CT. The radiologist would then interpret the exam and focus on confirming or ruling out a diagnosis of pulmonary embolism. What they would certainly not do in that case is spend more time reviewing the exam to measure the degree of compression fractures in my vertebra, for example, as an indicator of osteoporosis, or to quantify the degree of calcium in my coronary arteries as a leading indicator for coronary artery disease. These are chronic conditions which are not routinely reported by radiology, but AI can substantially help. Let's double click on this example of osteoporosis. Nearly half of all women and a quarter of men over the age of 50 will suffer an osteoporotic fracture in their lifetime. According to the National Osteoporosis Foundation, the cost of fragility fractures in the US is estimated to be $52 billion annually. This disease is often referred to as the silent killer and is the most common preventable cause of fractures, causing more than 2 million cases of broken bones in the US alone every year. Now, only 30% of vertebral compression fractures are reported from CT scans on a global average. AI can decrease that detection to over 90%. And we know that preventative interventions for compression fractures have been shown to decrease the risk of osteoporotic hip fractures by 40 to 70% in high-risk individuals. So by treating patients early through medication, physiotherapy, and lifestyle changes, we can empower both the physicians and the patients. Very simply, let me explain how this works. So the idea is that we're screening for chronic conditions based on pre-existing data. All patients over 50 with chest or abdominal CTs are reviewed by the AI. The machine learning algorithm then analyzes the CT scans for vertebral compression fractures, and positive findings are integrated into the radiology report and are validated by a radiologist. Now, once we've detected the condition, patients are engaged through their provider and can get enrolled to receive dedicated prophylactic treatment for their osteoporosis. The beauty of this is all based on pre-existing data, meaning that while the main radiologist workflow can focus on an acute condition that might exist in this procedure, AI can run in the background and detect additional chronic conditions, really shed a light on areas that are not being looked at. So this was a non-exhaustive discussion on the use of AI and machine learning and imaging to better manage chronic conditions across the population. Hopefully this inspires you to research the topic further. I know that Zebra Medical Vision would love to be part of the conversation. Thank you.